Age-related macular degeneration, or AMD, is one of the leading causes of blindness in Canada. Yes, blindness. In fact, it affects about 2 million Canadians, so you probably even know someone with AMD. But what is it exactly? Well, the macula is a small area at the center of the retina in the back of the eye. It's responsible for central vision and allows you to see fine detail clearly, so you can enjoy the beauty of a flower, recognize your neighbor's faces, hey neighbor, or read your favorite book. AMD happens when cells of the macula begin to gradually deteriorate. At first, you might not notice any changes in your vision, especially if only one eye is affected, since your other eye can compensate. But as AMD progresses to advanced stages, you might notice that your central vision is blurry. Over time, the blurred area may appear as a large dark spot, and straight lines might look wavy or distorted too. Whoa, weird. Age is the biggest risk factor for developing AMD, but genetics, lifestyle, and your overall health can also play a role. There are two types of AMD, dry and wet. Dry AMD accounts for about 90% of all cases. In the dry form, the macula gets thinner with age and clumps of a cellular debris called drusen collect beneath it. This causes a slowly progressing loss of central vision. While there's no treatment for dry AMD yet, some patients with advanced dry macular degeneration might benefit from a specific high-dose vitamin regimen, and Canadian ophthalmologists are involved in research for promising new therapies. Wet AMD is less common, but more serious. In wet AMD, abnormal blood vessels grow beneath or within the retina. These vessels leak fluid and blood, scarring the macula and resulting in rapid vision loss. Because wet AMD progresses quickly, treatment is time-sensitive. It's most commonly treated by injections directly into the eye of antivascular endothelial growth factor, or anti-VEGF drugs. That's a mouthful. These cause the abnormal blood vessels to regress, which helps reduce vision loss. At first, you will need monthly treatment. The frequency of injections usually decreases over time, but lifelong treatment is needed to prevent recurrence and vision loss. With treatment, further vision loss is prevented in about 90% of patients, and up to a third experience improved vision. So, how can you prevent AMD? Well, lots of habits that are good for your overall health also lower your risk. Bonus! Eating a heart-healthy diet, exercising regularly, and budding out can all help. Most importantly, get regular, comprehensive eye exams to find out if you're at risk. And since wet AMD can develop suddenly, you can help catch it early by regularly monitoring your vision right from the comfort of your own home. Just sit back, relax, and check your vision in each eye using an Amsler grid, like the one on our website. If there are any sudden changes in your vision, see an eye doctor right away. Remember, with early detection and treatment of AMD, it's possible to preserve your vision. It's a serious eye disease, and it needs serious treatment. Learn more at seethepossibilities.ca.